About a year and a half ago, through the input from neighborhood groups, I started distributing this poster to...
Do you have copies to pass around so folks here can take a look at what you're talking about? Thanks.
One for you and the unit taker, and several dozen here for this. What it is, it's a poster telling people about an insidious drug that heroin is, because in the north central neighborhood there, a year and a half ago, there were two houses that were very blatantly selling heroin. They were selling it in the park. They were selling it just out on the street outside of the store.
Sorry, just for clarification, the park, do you mean...
North Central Park.
Up on the corner of
North and Carroll Street.
North and Carroll, thank you.
Yeah. So that, so the citizens, they called me, and a number of us talked, and we came up with this poster, and what it has on it is a anonymous crime tips line to get people involved. They were getting very frustrated that they didn't feel as though we were doing anything about this house that was blatantly selling drugs. And they wanted to get involved, and they did get involved. We passed out hundreds of these. They showed up in all of the stores. That was a year and a half ago. They're mostly gone now. And, you know, it sort of dawned on me after a while that, you know, although this effort was a good thing to do, it was a very small effort, and it wasn't something that was really even going to make a dent. Through a short meeting that I had with the mayor and councilors Greenwald Filio and Chris Coates, I learned, gosh, you know, we started talking about drugs in the city, and they all had the same concerns. And what struck me is that everybody seems to be working on a little bits of it, and there really is no concerted effort. So that's, if one thing that we could get done to start here tonight is a concerted effort to create some sort of a group of stakeholders, of school officials, doctors, psychiatrists. And I mention doctors and psychiatrists is because they, you know, when you get sick or you have a malady of some sort and they give you some sort of a painkiller or something like that, you know, for a week or so, and your malady is over, I'm wondering, is there really any method to determine whether or not, once your malady is over, that you've just traded one sickness for another one, that your tooth is better, but now you're addicted to painkillers? And I'm wondering if that question is even asked, and whether or not the prescribing of the stuff shows up in people's medicine cabinets way too much, where kids can get them and things like that. So I think it's important that we come together with the doctors, psychiatrists, educators, the victims themselves, and the victims' families. I've gone to 2 funerals for heroin-based, deaths over the last year, and I understand last year there were 6 that we know of, and that's just what we know of. Went to a fundraiser last month, as a matter of fact, where a group of family and friends got together and actually formed a group to do something about this. They raised some money, and they're starting to put together things. And Senator Kelly was there and talked with them and is coordinating efforts on the state level, I think, with them. So that's a part of what is being done. But as a whole, we can get much more done. I'm concerned that it's such a large problem. As I was saying, my effort was such a small effort, and it really wasn't having much effect. My concern is that if we address it in a huge scope, that we may be just as unsuccessful. I would suggest that we pick out an area, a priority, and right now, heroin is the priority, whether anybody knows it or not. We all know people drink, we all know people smoke marijuana, we all know people take pills or whatever, but heroin is the killer right now. I mean, next year may be something else, but as in our daily lives, our priorities change every day, every year, and that's what we need to do, I think, is to focus on one priority, get some successes there, and then move on with that. but work with each one of these stakeholders to make sure that it isn't just a whole bunch of little efforts going on, that it's the whole picture. As far as the state goes, now, Molly, I'm sure that you've talked about it over there. The state of New Hampshire, in most states, they're complicit. Our whole economy is based upon the sale of liquor and cigarettes. So they have to get involved as well. And we have to start really thinking about what we're doing. Many of the people, or many of the kids that are starting very early, their parents have the same problem. They're just living a cycle, and it's hard. It's like poverty or anything like that. It's hard to break out of that cycle. So that has to be addressed as well through mental health people. So if one thing we can do is to form a task force to bring these people together, to have regular meetings, to talk to each other, to form opinions and strategies to move forward. And I'm asking the city to get involved as an arbiter, as just an official body that can put it all together and make sure that things are moving along an even keel. Thanks.
Thank you, Councilor. Any questions for Councilor Clark from committee members? No?